Hey, let's walk through the Excellence in Critical Care Transport course so you have an idea of how the course rolls out, see if it's right for you. Here we have, of course, site orientation and the orientation to our dynamic lectures. The dynamic lectures is not just like the slide 1, slide 2, slide 3, just a regular slide deck. Some of these slides have rabbit holes, like information rabbit holes that you can kind of enter into and get down deeper to basically resolve some really good questions and content of certain topics. This class comes with a pre-test and a post-test, so you have an idea of where you started and then, of course, where you ended to make sure that there's a good improvement there. And then we have 14 of these chapters, airway, of course, being one of them, and we have 14 topic chapters. And then it, of course, culminates in a certificate that is automatically presented, produced, and emailed to you. And you can also download it anytime in the course. Now, let me show you the actual dynamic lectures so you kind of have an idea of what those look like. And so here's our dynamic lectures. Now, what we have here, of course, like everything else, there's a title slide. We have objectives, a handful of others, information slides as it goes down. But what's different here is we have these items on here that are engaging elements. So slider bars like this, dials, different things to do. And we don't get too invasive, so we don't get too crazy. But what this does is allows us to create information rabbit holes. In this case, the path to unresponsiveness, right? So as a concept here, the path to unresponsiveness. Well, alert, awake, aware of self-environment. Then they go to lethargic, and then they go to obtunded, and then they go to unresponsive. So we were able to put this information into a little different way so you can kind of see how it rolls out. It's just a little bit different way to be given information and a little bit more engaging than just listening to a lecture. Here, for example, we're talking about cranial nerve 3, 4, and 6, and really specifically with extraocular motions. Here we have a picture of normal versus disconjugate. We also have an example of how to do an extraocular movement exam. So we kind of walk through the process, and you have me here talking about it. You also can actually do a normal exam. So you click this, and so here's our eyes. And if you were to track over and to do that in this simulation, you just click the button, right? So you click this right lateral rectus muscle, testing cranial nerve number 6. You click that and the eyes both go over. That's a normal finding. And if you were to go up, meaning you go to rectus muscle on the right, cranial nerve 3, they both track, they both track, they both track. You can reset it. You go up, reset it, down, reset it. This is what it looks like as a normal assessment, right? So you've experienced that. Then you can do an abnormal. And as you begin to test and you click this button over here that's simulating, looking to the patient's right, and only one goes over, you're experiencing that now. And you're seeing what those are like. We've built hundreds and hundreds of these scattered throughout the lectures. So these lectures, they're not just information quiz. It's not just the lecture and the quiz. What we've offered, and we've spent a couple years building, is lecture, practice, and quiz. This is one of the ways in our dynamic lectures that we can actually invoke practice. And one of them, and there's hundreds and hundreds of examples of these throughout the course. Another way that we can really get into the practice session is through skills practice. So let me show you next one way we can practice skills. Let's do an RSI one. So here's our rapid sequence intubation practice session, right? So we've already had the lecture, and now we're going to practice it. We're actually going to do an RSI on somebody. So we click start, we get a little information. Here's a 170 pound patient. We can click see vitals. We actually see a set of vitals on a monitor. Granted, we've created this monitor. It gives that feedback. All right, we can X out of that. Let's proceed to the RSI. First thing, okay, it's a patient who weighs 170 kilos. Great, 170 divided by 2.2, and that's what it calculate the weight, and type your answer below in kilos. So we got to make the conversion, practice, right? We need to be able to do this. After you do this a handful of times, if you weren't already good at this, you will be good. And so every time we do this in the future, whether it's for RSI or something else, boom, boom, it should come at as natural, and that's what we want to translate out in the field. So that's correct. But let's say it wasn't correct. If it was incorrect, then at this point, we're just going to go to the next question. If it was incorrect, then it takes you out of this scenario, this simulation, and it gives you a direct mini lecture on this exact point. You'll start talking about like, well, this is how you calculate pounds to kilograms. It tells you what the wrong answer was. It tells you what the right answer was and why. And then it tells you how we arrived at that. And then it gives you actually you get a couple quiz questions to make sure you understand it before dropping you back into the simulation. So what happens is if you get something wrong, you get a tailored mini lecture on getting that wrong. And this is when we want to get things wrong, is right now when we're practicing, not later when in the real world. We don't want to make a mistake there. We want to make as many mistakes in training and practice as possible so that we make fewer mistakes out in the real world. Next question is, okay, the patient's blood pressure is 82/60. What should we do here? Probably not do nothing, but let's say that we choose this, do nothing. Here's an example of what it looks like when we get something wrong. It says incorrect. And it takes us out of that into what we call remediation loops. So we get a little information on blood pressure and blood pressure control. More information gives a little bit of info, and let's practice it. So now it's like, okay, your adult stroke patient's blood pressure is 82/52. What can we do? So we probably need to do something. So fluid bolus might be appropriate here. That was correct. And then so you get a couple quiz problems. You get the one at least, and then you can choose to do number 2 or number 3. If you're feeling good, then you say, yep, I'm good. I'll move on back to the simulation. If you need more, then you literally just click problem 2 or problem 3. You can also email us if there's ever a question you want to ask directly, like maybe something's getting off. Send us a question, and then we'll get you followed up. And so now we get to this particular portion of the RSI where it's asking you, all right, let's choose the sedative. So I mocked this RSI kit up as a box, that's going to open up. So the way to do that, you can click vitals to see the vitals. You can click the RSI to see the manifest that's in the box. Or you can just open the box with this dial and turn. And what you're going to want to do is find the one that you want isolated. Let's say you want to do etomidate. Here's etomidate. If that medicine is not contraindicated, then clicking choose medicine will be correct, right? So if this is the right medicine, if this is one of the few right medicines for this job, then clicking choose medicine would be correct. Let's see if it's okay. It says that's correct. And then we're going to move on. And then it's going to ask you how you draw it up, how much it's going to, the dose, and then how you actually draw it up. It makes you actually use the information. And again, we've tried to build a system where it's a lot of practice. There's a lot of great lectures out there, and our lectures are great as well. I've worked very hard on building a lot of this. I've worked with people to make sure that the content is solid, but we want you to practice. We want you to practice as much as possible, because again, like we said, we want you to make mistakes here, not out in the real world. Okay, finally, what I want to show you is our full practice cases, where we call them our GPS, our guided patient scenarios. And what we do is you have a way to fully assess your patient, gather information, figure out the things that could be causing it, then you make a diagnosis, and then you treat that diagnosis. And so we want to show you that real quick. Okay, here's our guided patient scenarios. Here's a case from an actual chapter, and let's get to it. So it gives you a case intro, reminds you that these compasses can help you with hints, so you can click if you need a hint. In this case, you're called to a 22-year-old, 5'1", and 130-pound female who's found unconscious. Staff's currently working up the patient, so they're getting information. We go to assess the patient. And here is the center page. Your center assessment page is your initial assessment. You can see the therapies that were already given. Here's a little write-up. Some of this includes the information that's on here. And these buttons will lead to rabbit holes of information that you can go and look. You don't have to click all of them, but you're looking for information to help congeal and formulate a diagnosis or a differential for sure. You can see the monitor and see the actual what the patient looks like. History, you can go in and ask specific questions that are here, and an actor or me or a computer generated voice will answer those questions. And what we usually say is, like, if you take notes with like a notebook, then when you're with a real patient, Do that here. If you take a piece of tape and put it on your leg, then do that here. And actually practice the way you're going to be working in the field. So once you have the information from there, you can go on to the next button. Here's the labs. If there's any labs, these tiles will be removed and the information will be displayed. Images, there might be one or multiple images here. And you're gathering information all tied to why this patient is unconscious. And airway, breathing, circulation. With airway, there's a piece of information here. With breathing, if you tap on these boxes that have for the various lobes of the lung, you will hear breath sounds. It gives you the information for specific vital signs there as well. If we go into circulation, vital signs, if you click infusion, you'll go to a page where it shows you all the current infusions, what they're going in, how they're mixed. You can make an assessment if they've made something wrong or right there. Labs, you go back to the lab page. Look at the 12 lead. Here's your 12 lead. Here, if you click on this button that's pointing to the carotid, you will get a metronome that matches their current pulse. And so just like in the field, if you feel for a pulse and you look at your watch, you try to figure out how fast it's going, it's another way to practice that. And then here is, if you click this, I just clicked it, and how slowly the color comes back, that's your cap refill. So we've built all these practice elements and activities to be able to gather information. And what this does is it pushes you all the way to making a diagnosis, where you would choose the actual clinical category, and then the next is the actual diagnosis. And then from there, you have anywhere between 5 to 10 questions on how to manage it. It has me asking you those questions with video as if we're working together. If you make a mistake, you go through one of those remediation loops again and get a tailored lecture on that little bit that you missed. Everything you get right, you can progress pretty quickly through the content. It's an unbelievable experience that breaks the mold from just lecture and quiz and drives it down into lecture with practice, and then finally a quiz or a final exam. For amazing critical care education, reach out to MeduPros.com today.